I am happy to be here today, talking with you guys. And I think I continue to be interested in imitation, and I'll talk about a study or two that we're doing in relation to imitation. But two other things that I'm really interested in working on right now is describing what BCBAs mean when they say natural environment teaching or naturalistic teaching, and providing some guidelines for the field about what that should look like and how we could do that a little bit better, and how that's related to the use of NDBIs, naturalistic behavioral developmental interventions. So that's something that some of my students are working on with me now. And and I'm sort of constantly working on single case design methods, and how, you know, what we can answer is constrained by how well we do our research, and how single case design methods can be improved. So that's sort of a special interest of mine that is pretty consistent over time. So yeah, those are two things that I'm really excited about. Also, I'm always interested in teaching imitation. Like you said, it's quite important, and I actually became interested in teaching imitation when I was a doctoral student, and I did a systematic review about 10 years ago with my advisor, Mark Woolery. And so what I'm going to talk about today is an extension of that. It's the study here in Topics in Early Childhood Special Education, where I essentially updated the review that I wrote 10 years ago, both because there were a lot of new studies to include, and because I learned a lot about how to better do systematic reviews in the last 10 years. So I wanted to see if what we found in that old review held up. And of course, some of it did and some of it didn't, but we will get to that story now. So one of the reasons why I think imitation is particularly interesting is that there's this bidirectional relationship between a child's cognitive skills and imitation. So children who have lower cognitive skills tend to have less proficient imitation. So it sort of goes in that direction. But also, when you teach children to imitate, it actually is associated with improvements in cognitive skills. So this bidirectional relationship makes it really, really interesting, and I think really important to ensure that kids have the imitation skills, so that one direction is you know, hard at work. So if we can teach kids to imitate, they have more opportunities to improve their cognition, which seems really important. So given that, we do know that some kids with disabilities have difficulties learning how to imitate. And I sort of put those difficulties in two bins. And of course, nothing's ever clean when you're categorizing difficulties. But some children have imitation delays, and this is associated with intellectual disability. So children who are sort of slower to learn lots of different developmental skills are also slower to learn imitation. So kids with intellectual disability, for example, often have delays in learning to imitate. So they might imitate as well when they're 4 as a child without intellectual disability would imitate when they're 2. Then there's this separate bin that mostly characterizes kids with autism. And this is an imitation deficit that's not associated with an intellectual disability. So these sort of, despite having sort of typical cognitive skills, the child still has an imitation deficit. So a child with autism without intellectual disability, who's sort of in the typical range, might still have imitation deficits. And this is likely, the research here gets a little bit fuzzy, but it's likely due to the social differences that are associated with people who have autism, right? So people who have a diagnosis of autism must sort of diagnostically also have social skills differences. And there are tons of social skills that are used when you imitate, right? So just like social referencing and paying attention to the other people is required before you can imitate them. So there's this sort of cognitive piece that's associated with imitation, and there's also a social piece that's associated with imitation. And of course, if you have a child with autism who also has intellectual disability, you might have a little bit of both of those at play. So I think it's important to think about, when I did this new review, I really had thought a lot more in the past 10 years about why we need to imitate. So when I did that first review 10 years ago, I was primarily concerned with the sort of instructional functions of imitation, and I had done some work with prompting procedures, and it was clear to me that kids who did not imitate often needed full physical prompting to learn new skills. And while that's acceptable, it's a little bit problematic because it's more restrictive, right? So if a kid can imitate, they can access different model prompts that are less restrictive than the full physical prompts. So full physical prompts aren't necessarily bad, but I always like to be as least restrictive as I can be. So having a kid who can follow a model makes me not have to do restrictive instruction. So I was really interested in that when I sort of started this journey, right? We have to teach kids to imitate so that we don't have to use full physical prompts. And it's interesting because we tend to use full physical prompts to help kids learn to imitate. So I'm using full physical prompts so that I don't have to use full physical prompts. But that was sort of my primary interest. And as I got more interested in natural environment teaching and NDBIs, I was like, oh, there are actually lots of functions to imitation, especially for young children. Initiating and maintaining social interactions during play. So typically developing infants and their caregivers do lots of imitation. And if you've ever been in a group of toddlers, they do the same, right, with each other. So it's a really effective way to initiate and maintain social interactions. And so if you're thinking about kids with autism who often have difficulty with that kind of thing, teaching them to imitate can give them another avenue to initiate interactions. So it can sort of have like snowball effects, right? So you teach them to imitate and they get more access to social interactions, and this improves their cognition and their social skills. So that social interaction function feels really important to me. The third one that I would say is pretty important is access to observational learning. So this is really often used as a rationale for inclusion, right? So kids with disabilities need to be with typically developing peers because they can watch and learn from them. And so this is a little bit different than initiating social interactions, right? It's watching another child and learning how to do something because that other child knows how to do it. So all pretty different functions of why kids need to imitate, right? And the last one is it's a little bit fuzzier and more complex, but it's essentially like a social and cultural match, right? So you can use imitation. We all do it, right? To sort of go along with social expectations. So for example, when we walk into a room and we're somewhere that we've never been before and we aren't sure what to do, we all look around and just do what everyone else is doing, right? And I'm not really arguing for the value of conformity for itself, but it's sort of socially valued, right? To be able to sort of read the room. So it's based on observational learning, but also has some social aspects. So I sort of call it this fourth fuzzy category, which is what you can do when you're really, really good at imitating and discriminating how to use it. So we'll primarily focus on those first three today.
Jen, sorry to interrupt, just to deliver the first keyword. Guys, the first keyword is prompting. I repeat, the first keyword is prompting. Thanks, Jen.
Of course. So given these sort of identified functions of imitation, so reasons kids might imitate, we actually have some teaching strategies that kind of match up well. So if we're thinking about using imitation to learn from a model to sort of avoid physical prompting, our teaching strategy is to use prompting procedures in a masked trial format, right? So it's like I said, we use physical prompting to teach kids so that we don't have to use physical prompting. And this is sort of how I came into interest in imitation, is through this sort of masked trial model. And I think it's how a lot of kids who are receiving services based in ABA are getting their imitation instruction. So I think this sort of masked trial, discrete trial training model is really often used to teach kids to imitate. And I think it's good for this learning function. If we're talking about recruiting and maintaining social attention, that function, we really should be teaching kids to imitate in a way that is embedded in play, right? So this sort of embedding imitation opportunities in play matches with the function of recruiting and maintaining social attention. And if we're interested in observational learning, particularly that occurs in sort of a classroom typical environment for young kids, then we maybe should consider teaching embedded in activities with peers in the activities, right? So if you think about the functions of imitation, there are some sort of like clear strategies that we might use to sort of better match the function, right? So I think part of my argument in this paper is that if there are lots of functions for imitation, then we should probably have lots of strategies for teaching imitation. So we did a systematic review to find all of the published and unpublished articles and dissertations that taught young children with disabilities to imitate. We found 34 unique studies that included 122 young children with disabilities, mostly preschool aged and mostly kids with autism. And we did find that there were these sort of 3 broad strategies for teaching imitation within these 34 studies. So, like I mentioned before, there are strategies that are well matched to function. And so I'm going to sort of describe the 3 strategies that we identified as part of this review. The first one we called mass trials, and it included video modeled mass trials as well as live model mass trials. I'm just going to refer to it as mass trials for now. And when mass trial instruction was used, this is sort of the typical imitation instruction that I've seen a lot, which is the adult implements it, the adult is the model. And the context is sort of typical table time instruction. And there's a very clear cue where you engage in an action and then you tell the child something like, do this or do it like me. So that's sort of the type of imitation that's well matched to sort of an instruction function of imitation. Then there was what we called CBET, or classroom-based embedded instruction, or teaching. So the adult was the implementer generally, but the model is the peer, right? So these typically took place in things like art activities or Play-Doh activities, and the peer would do something and the adult would instruct the focal child to do that. You could also do classroom-based embedded instruction by having the peer provide the cue as well. So the peer is doing something and the peer says, do this. We actually had a study where we were trying to get the peer to do the actual cueing, because that makes a little more sense to me. I think that's how it typically happens in classrooms. But that was pre-COVID, and we, of course, everything shut down. We haven't redone that study yet, although it certainly does need to be done. And then there's what we call PBET, or play-based embedded teaching. So this one's done during play. It's activities that the kid wants to do. The adult serves as both the implementer and the model. So almost none of these studies have included other kids. It's a one-on-one context. And the cue is generally indirect rather than direct. So instead of saying, do this or do it like me, the implementer would say something like, look, and then they would do an interesting action. So there wasn't this sort of direct necessary imitation. Although in most cases, if the child didn't imitate, once they sort of did this cue, they would provide prompting to imitate afterwards. So this one's kind of interesting because the cues that the kid should imitate aren't very clear. So I want to talk about the outcomes for each of these three types. But I'm going to share two things with you beforehand because I'm going to show you some graphs that will make more sense if I've talked through this. Sometimes I get into the weeds with these things, and I'm going to try not to. So when we're thinking about imitation, I think there are two important things to think of, and just sort of single case design in general. I really wanted to know, when I was thinking about outcomes, whether the variables, the imitation variables that were measured, were primary or secondary variables. So in some studies, a researcher implemented DTT with a child, and the child imitation outcomes were the primary outcomes. So that's how they made their experimental decisions. In other studies, something happened, like the researcher trained the parent to implement a PBET intervention, and the parent implementation was actually the primary variable. It was how they made their decisions, but then they had child imitation as a secondary variable. So we had a hypothesis going in that anything where imitation served as the secondary variable, any study where that happened, the outcomes would probably not be as good as studies for which imitation was the primary variable, just due to related to things such as like increasing imitation in baseline might have happened if it was a secondary variable, because people weren't making their decisions based on those things. So we sort of went in saying, we think primary variables are going to have better outcomes than secondary variables, so we're going to code those. You'll see that on the graph. The other thing is that we really wanted some measure of generalization of imitation. So if you look at sort of the most traditional definitions of imitation, they generally include that something's only imitative the first time it happens, right? So once you've done something a second time, there's learning history involved. So the reinforcement from the first time might impact the likelihood that it happens the second time. So I don't entirely prescribe to that sort of vision, but I do think it's important to know whether kids can do this outside of the trials that we've specifically taught them to do it in. So, so we had three sort of names for this. We called context-bound variables, those in which they only measured imitation during the intervention sessions, so during those trials. Partially context-bound didn't happen much, but it's something similar to, like, they measured it and the intervention was still going on, but it was a different implementer or a new set of toys. So it's like a little bit of generalization. That was our second type, partially context-bound. And the third type was generalized, which means they measured generalization in an entirely new setting without intervention present. That also didn't happen a lot. But it seems important, right? If we're going to teach kids to imitate, the whole reason that we're doing it is so that they can use it sort of out in the real world. So you'll notice on these sort of complex graphs that I'm going to show you that we have, I don't know if you guys need me to move this so that you can see that. So we have filled and unfilled data points. The filled ones are the ones that are primary variables in the study. And then you have circles, triangles, and squares. The circles are the ones that are context bound. So if you have a filled circle, it was a primary variable and it was measured in the context of instruction. That's mostly what we have. So the other part about this graph that you should know is that this is a summary of probably in this case about 15 or 20 studies. And the studies get a quality score. So like perfect studies would get a 4 and an outcome score. And generally what we say is outcomes of 3 or 4 are associated with functional relations. So what you can see for these data, which represent all of the mass trial data that we found, oh goodness, there we go, is that there's a fair number, maybe half or a little less, where functional relations were identified for mass trial studies. So in this sort of 50% of studies, we identified a functional relation so mass trials were effective for teaching kids to imitate. We also have a relatively high number of studies with a 0 or a 1, which essentially means there is no functional relation identified for the relation between mass trials and imitation. So it's kind of a bummer, right? This is, I think, the most prevalent way that we teach children with autism to imitate. And it's, you know, effective sometimes, but not nearly often enough. And I will say that most of these, I'm sort of going to ignore quality today, although if you have questions, I'm happy to answer them. But generally, these studies had high enough quality that they were interpretable. So in previous reviews, when people have used this tool, it's called the SCARF, they've used like 1.7 or 1.8 as the good enough to interpret guideline. So you'll notice that most of these studies are interpretable, and that'll be true across all the graphs, so I won't talk much about it. So basically, in mass trials, we have like a 50-50 shot of getting a functional relation for teaching imitation. And you'll notice that all of the secondary variables and all of the partially context-bound variables, except for one, are in that no functional relation category. So mass trials is somewhat effective, but only for teaching within the instructional context, not sort of any generalizable forms. So this graph represents CBET. So this is the classroom-based ones where kids are imitating peers. What you'll see is there's not that many of these studies, but that the outcomes were generally good. So these are all 3s and 4s, except for that one on the bottom. So in terms of instructional sessions, this was 100% effective. In terms of more generalized, the partially generalized data had a functional relation. The entirely generalized data did not. So essentially, this appears to be pretty effective, but we also need more data. This isn't very many data points. I will also say that one possible reason for the success of this type, at least in research, is that people often required that children in these studies be able to imitate an adult, but not imitate peers. So these aren't kids who start with 0 imitation in general. And that's very different from the children who were in the mass trial studies. So it looks as though CBET is quite a bit more effective than mass trials, but I think what we really have are 2 different sets of participants. So it's probably harder to begin an imitative repertoire than to sort of shape up a kid's ability to imitate in other contexts, which is essentially what these studies have done. And I will say for the classroom-based embedded trials, I think we should be doing this with kids who can't imitate at all. I think there's the possibility that it would be effective, but that just isn't how the research has played out. So just want to be clear, I'm not saying that DTT is the only way to teach kids who don't have an imitative repertoire at all, but that is where we have the research base for these kids. So like I said, there's only 2 generalization data points here, and one of them, there was no functional relation. So we still have limited data about whether CBET is applicable in real world settings, which is, of course, what we're most interested in. So final graph is play-based embedded trials, what I call PBET. And again, you'll see that there's lots of data in sort of that upper right quadrant, which is where we want it. That means there's good data, it's high quality studies, and the outcomes are good. You'll see that actually there's 100% success rate for primary variables that are context bound. So exactly what we're teaching them in the instructional sessions, this was successful. And then you'll see there's lots of variables for this type where the imitation variable was actually secondary, and the data for those are less good, which we expected. And also the generalized data are less good. So of the 3 data points where they measured generalization, only one of them showed a functional relation. So overall, we have these generalization outcomes represented by squares and triangles. We really didn't get good outcomes from these studies. And to be fair, it was most often not measured. So it's hard to say whether we don't get generalization or whether we're just really bad at measuring it.
Jen, I've got a question that might be relevant at this point.
Great.
Did you come across any studies using the mirror protocol, as in using a mirror to train these skills?
I did at least one, and I think this is, it's really interesting or potentially interesting. Though I think that the one that I found did not meet our criterion because it either didn't have enough data points or didn't have enough potential demonstrations of effect. And my opinions have changed somewhat, but we also excluded non-concurrent designs. So I would have to look up the reason why we excluded it, but we did find at least one, and it didn't meet our inclusion criteria. But certainly that is another area of research that's worthwhile. Good news is there's lots of interesting questions to answer here. Bad news is that I think we're not quite sure the best way to teach kids how to imitate yet. Yeah, great question. So sort of a summary of what we found. All of the teaching types were at least somewhat effective for increasing imitation, especially during intervention sessions. All were not great at increasing generalized imitation, at least the way that the researchers measured it. Mass trial was the least effective. It also included the most trials on average, which is a little bit disappointing because lots of people use mass trials to teach kids, especially kids with autism, to imitate. But I don't want to overinterpret those results because I think that the kids who were in those studies were our real non-imitative kids, and the kids who tended to be in the CBET and PBET studies were poor imitators, but not necessarily non-imitators. So we don't have much data about generalization. What we have is a little disappointing. We really need to figure out how to get kids to imitate in generalized contexts. That's really hard because it's hard to know when kids should imitate, right? So if kids are playing together, what rate of imitation is right, right? They shouldn't be constantly imitating other kids. That would probably be annoying. Other kids probably wouldn't like it. So it's really difficult because there are often, outside of instruction, there are often not rules about when you should imitate and not imitate. So it's difficult to teach those kinds of discriminations, right? When should you imitate? And we especially don't have lots of data about kids with their peers. And I expect that that's important because I think that kids who don't have imitation difficulties imitate other kids when what they're doing is interesting. So I'm a little bit worried that when we do DTT and PBET kinds of interventions, we are teaching kids to imitate, but maybe not in the context in which they should be imitating, which is when they think somebody else is doing something that's interesting. Final point, the duration of instruction was really variable within and across types. So we don't really have good data that say what we should expect when we have non-imitators, how long should it take them to learn how to imitate, and how that's related to participant characteristics. And that's largely due to the fact that we have really spotty data on what the participants were like anyway. So for the mass trial context, almost no one reported like pre-test. So the motor imitation scale was used pretty often for PBET and CBET intervention. So this was sort of like a baseline level of how well the kid could imitate in this structured standardized assessment. But when we use DTT or mass trials, they actually never for live model DTT reported this sort of like pre-test. So I think we really need more information about who these kids are, so that we can better characterize, if you have a 2-year-old non-speaking child with autism who also has, global developmental delays, how long is it going to take that kid? How many trials can we expect for that kid? Versus a 4-year-old kid who doesn't have any cognitive delays and has more advanced language. And can we sort of figure out how long instruction should last?
Can I just jump in there to give the second keyword? The second keyword is research. The second keyword is research. Thanks, Jen.
Of course. All right, so some implications. I tend to get ahead of myself in presentations. I've probably already talked about this. Yeah, I have. So we really need more data about the participants so that we can figure out sort of a match between the participants and what we're using in terms of teaching strategies. We really need more data from generalization context because that's ultimately what we care about. If you think about those functions, right? Even generalization contexts that are pretty similar would be helpful. So if I teach a kid to imitate with DTT, can I then teach him other skills without full physical prompting? As far as I know, no studies have tested that, right? It's the reason we're doing imitation, but we don't test it afterwards, which is sort of unfortunate. And then I think the third implication, although we really need research on this, and we are going to try to do this in my lab this year, is I think we really need to teach children to imitate using all of these strategies put together, right? So we really need kids both to be able to use models and instruction and to be able to use imitation while they're playing or while they're at activities with other kids. So if that's true, we probably shouldn't, train and hope. We probably should planfully teach kids to imitate in various contexts, sort of under various, like with various discriminative stimuli present. So questions that I still have about imitation that I think are worth answering. Again, can we teach kids to use imitation in a generalized way? And is the answer potentially that we need to be teaching them using all of these strategies, and that will help them learn that imitation is not just a thing that happens during instruction or just a thing that happens when you have a responsive adult play partner. So I think that could help generalization, although it's an answerable question that I'm hopeful we'll get to answering fairly soon. Also, I think this is something that we're trying to answer right now, and I have sort of a preliminary answer for you, is can we teach imitation without using full physical prompting? So almost without fail when we teach imitation, we do it with full physical prompting, right? We can't use model prompts because they can't imitate. So almost always we use a full physical prompt to teach kids to imitate. But we were interested in whether that was necessary. So we were doing sort of a reverse prompt. We don't have a good name for it yet, but generally, if I was teaching a kid to imitate, if I had a rattle and I shook the rattle and that's what I wanted them to do, I would full physical prompt them to shake the rattle. We are trying to, and rather than touching the child's body, we are trying to touch the object and to help them imitate without touching them. So what that looks like is if we hand the child the rattle and then we hold the rattle and shake it rather than the child's hand. Preliminary evidence says that it's probably slower than using a physical prompt because there are more failures, right? So if a kid drops the rattle once I touch it, they didn't do the action. And that generally doesn't happen with full physical prompting. Unless a kid really hates full physical prompting, you generally get a correct response, a prompted correct. That doesn't happen when you aren't touching them. So there's more errors for sure. So we think that it's a little bit slower, but we're also getting some progress from kids. So it's possible that this is a potential alternative for kids who don't like physical prompting. It's probably not the best alternative for kids who don't mind physical prompting, because it will be a little more full with errors and a little bit longer. It'll probably take a little bit longer. But I think it's interesting. We need some prompting procedures for kids for whom physical touch is aversive. So it looks like we might have that, although certainly more data are needed on that. We are only on kid 2. And then I think we really have to figure out how we should be teaching kids to imitate, right? So if you have a 2-year-old kid who has some emerging skills versus a 5-year-old child who still doesn't reliably imitate, do you give those kids the same imitation instruction? Typically we do, and mostly it's discrete trial, but I'm not convinced that we should. And I'm also not convinced that we know how to balance it, right? So I don't necessarily think that we need to only use play-based imitation instruction or only use mass trial instruction, but I'm not sure how we should combine the two, even though I think it's a question that's worth asking. That is all I have for the official presentation, but I want to know what your questions are.
Thank you, Jen. That's really, really interesting. I have to say, I have, you've given me things to think about. I haven't thought about the different functions of imitation and matching the training to the different functions. I have to say that I think that is particularly interesting. Guys, please do post your questions, and I'm happy to read them to Jen for you. Jen, as people are formulating the questions, could I ask one? So you pinpointed that generalization was not always assessed properly, and I was wondering, what about maintenance? Did they measure that at all?
Yes. So actually, maintenance outcomes were the only area in which the DTT interventions shone. So they actually had the best maintenance outcomes. And that's probably because it's really salient, right? The cue was salient. There isn't as many competing things to do. In both of the other contexts, there are competing activities. So in the absence of continued instruction, it might make sense that there are like interfering behaviors, essentially. So there was pretty variable maintenance for the other two, although better than baseline generally. And pretty good maintenance actually for the masked trial intervention. So that's great, right? And it probably is in part due to the fact that that imitation is helpful, right? So one of the things we can do to help generalization outcomes is to pick skills that are useful. So yeah, so actually maintenance was fairly robust, especially for mass trial interventions.
Okay, thanks, Jen. I've got a few questions that have come through, and thank you to those of you who have posted them. Have there been any studies comparing video modeling for imitation versus in-person imitation?
That's a good question. Oh, you guys, I looked at these studies more than a year ago. There are certainly in that body of studies video modeling and live modeling, and I don't remember any that directly compared them, although I have opinions about video modeling for imitation, and that is that unless you want a kid to be able to imitate a video, you should probably teach them live, right? So if you it goes back to the function, right? So if you want a kid to imitate you so that you can give them model prompts for instruction, then you should probably teach them to imitate you rather than a video, so that they then don't have to generalize from the video to the person. I will say imitating a video is helpful, right? I got my gas changed and they didn't know my oil changed and they didn't turn off the little oil light. So I like looked up YouTube and found someone who showed me the buttons to press to like reset the oil light, right? I think all of us probably use video modeling at home. So it's not that it's entirely unuseful. But if your function isn't related to using a video, I don't know that there's tons of benefit to video modeling. You can argue that the models are the same every time, but I kind of think it's helpful for kids to learn to watch for differences in the model and still be able to imitate. So there are a couple of video imitation studies, and I'm not convinced that it's a good idea generally if we're talking about teaching kids to imitate based on, you know, imitation, instruction or social kinds of functions.
Thanks, Jen. What are some of the first imitative actions that you would present to a child? There's a question about that.
Yeah, that's great. In my first review, we talked a little bit about that, and I didn't really tackle it in this review, but I think generally people consider actions with objects easier than actions without objects. So teaching a child to, you know, like laying 2 blocks together is easier than teaching a kid to wave. And also teaching actions that kids can see are easier than teaching them actions they can't see. So teaching to imitate this is easier than teaching to imitate this because the child can't see themselves doing this. And those are the only 2 rules that I think we feel pretty good about in terms of imitation. I would say, given a kid's motor skills, I might pick imitative actions that I've seen the child do before. So I might pick meaningful actions. So I might pick, you know, stacking a block or, you know, making a train with a block, as opposed to doing something like hitting blocks together, right? Mm-hmm. Unless that's an action that they do. I would say if you're sort of a like imitation originalist, you would say that we can't be sure those are imitations because the child's done them before and maybe they're accidentally doing them again. I'm pretty convinced when a child, you know, does it 5 times right after I do it, that I'm getting what we call imitation, even though it's not a new action. And also, I think it's not terrible to get some accidental imitations in the beginning, right? So if I'm doing something with a hammer and I'm having a kid hammer something, I also want to have the kid doing a not hammering action. So I don't want, so in this study that we're doing now, we have a hammer and like a little pegboard. And one of the actions that we model is hammering a peg on the pegboard. And the other action that we're modeling is putting the hammer above the kid's head, which is a harder action, but it requires the kid to know, like, oh, the presence of this hammer doesn't necessarily mean a hammer all the time. And it allows half of their trials to be the conventional action. And so if they sort of accidentally just do it right without even attending, they get reinforcement. And although it makes it slower for us to figure out when they're actually imitating, it also allows the kids some sort of free reinforcement in the beginning. So what we're sort of doing right now with that particular action is that we are on a like 5-second delay for the conventional action, and we actually moved back to a 0-second delay for the unconventional action because it's harder to do. So the kid is getting it, but certainly she got all of the conventional actions before she got all of the unconventional actions. And some of that is probably due to sort of accidentally reinforcing things they would have done anyway, even without the model. And I think that's okay as long as you take a conservative approach to interpreting your data, right? We don't consider her imitative until she's doing both of the actions by herself based on what we do to begin with. But I don't mind them getting some free reinforcement in the meantime.
Roger that. How do other disciplines teach imitation? Are you familiar at all with what other disciplines are doing on this front?
What other disciplines?
Mm-hmm.
That's a good question. I would say that some of the data from the review were from special educators, and some were from sort of more ABA focused. And those are really the only two places where I saw it come from in research. So I don't know that there are tons of other disciplines that are thinking about intervention for imitation. I could be wrong, but I didn't come across it.
Okay, thank you. I suppose potentially speech and language therapists might also be working on imitation skills. I'm just thinking about oral imitation skills, and
yes,
I would assume they do, but again, yeah, as you said, I wouldn't be certain. Another question says, what would you recommend when kiddos overgeneralize and imitate behaviors that might be considered challenging from their peers? Do we still work on other imitation skills, or do we pause teaching imitation in the classroom until they stop imitating those behaviors that we kind of don't want them to imitate?
Yeah, this is a great test of generalization, actually. So I would actually argue that it's fairly appropriate for kids to generalize by imitating sort of naughty actions. I think we see it with typically developing kids pretty regularly. So I would say if a kid regularly imitates their peers when they're doing something naughty, that kid is actually a pretty good imitator, right? They can pick out the naughty thing in this chaotic classroom environment and do that thing. So that tells me that they're paying attention and are pretty good imitators. So if they're doing that and they're not imitating during instruction, then probably what you have is a motivation problem during instruction, right? It's like more interesting to imitate the naughty behavior than what's happening in instruction. So you might have a reinforcement problem with instruction, right? And it gets tricky with imitation because it overlaps a little bit with compliance, right? So I don't necessarily want to do imitation training with a kid if what I'm actually doing is just compliance training. I really want to do imitation instruction with kids who need help learning to imitate rather than kids who just need help being compliant with a prompt.
Very good point. Someone has commented and said that yes, indeed, speech and language therapists also work on imitation, especially if they're supporting people who are using sign communication. So yeah, that's a very good point. Thanks, Jill. Another question says, what are some strategies that you would recommend to teach kids actions they can't see, for example, touching their head? I think you have kind of covered that, but perhaps you want to quickly answer it again.
Yeah, I think I would teach those harder actions after I know that the kid can do the easier actions. And generally, you don't have to teach kids that many different imitative acts before they generalize to all imitative acts, right? So I would teach 4 or 6 easy actions with objects and then test to see whether they've generalized to actions that they can't see and to gestures or actions without objects. And a lot of kids will generalize and you'll never even have to teach those separately. But for kids who don't, I would definitely teach them after they're very fluent at doing the sort of easier skills.
Gotcha. Okay, I don't see any other questions in the chat, so I can deliver the third keyword. It is going to be assent. The third keyword is assent. I was just inspired by your point about compliance. So the third keyword is assent, as we say consent, but assent in this case, okay, guys? So you are going to, I had the email where when you guys sign up in that registration form, I've got my email there, but let me add it here as well in the chat for you. So you send me the 3 keywords, you send me your name as you want it on the certificate, and you send me your certification number if you're BCBAs. If you're not BCBAs, I can issue a simple certificate for you, so just let me know. Please send them no later than tomorrow morning, preferably straight after. If you send it to me late, I'm not going to issue the CEU because the BACB is quite strict with when we issue CEUs. Okay, guys, so preferably when we finish the call, you just pop me an email with the requested information. Dr. Leford, thank you so much. It's been such a pleasure listening to you present. I'm sure we all learned so much about imitation skills, such an important cusp. And we're looking forward to having you again at some point at our journal club to hear more about your wonderful research.
That sounds great. Thanks so much for the opportunity.
Pleasure. Okay, thanks everyone. I will see you soon. We're gonna have Dr. Stobitz again from Vanderbilt. I don't know why I'm inviting everybody from Vanderbilt, but we're gonna have Dr. Stobitz on the 15th of December, if memory serves me well. So look out for that flyer. I'm gonna get it out there soon. Thanks again, everyone.
Oh, she's great.
Yes,
She's great,
I know.
guys. You're gonna love her.